Hi, my name is Dr. Bjornstad, and I'm a pediatrician and an epidemiologist and a member of the ELCA, and I'm part of the Southeastern Synod COVID Task Force. And I was asked over a month ago by Bishop Strickland to make a video promoting COVID vaccination, and it's taken me this long to have the energy to do so. I've been making educational videos for the Southeast Synod since March 16, 2020. That has been 17 months of videos and Q&As. We didn't know a lot back then. We were teaching everyone about exponential rise and what to do to flatten the curve. But 17 months later, we're dealing with a worse strain of COVID. It's more contagious. It's attacking young adults and children at record rates. And again, we are seeing an exponential rise. Why can't we learn? As others have said, we have seen this movie before, and it doesn't end well. I'm a physician, and I have worked on the front lines, and we are tired. I am tired of seeing entire families die within the span of a couple of weeks. Families, you heard me right. The mother, the father, the uncle, the aunt, the grandmother, all gone. Families saying goodbye over iPads. I've seen numerous children get very sick. Sure, they're more likely to survive, but do you know what that means? A child in the ICU could stay there on upwards of 1 to 2 months, connected to large machines to keep them alive. Then there's several months of recovery, while the parents are struggling to keep their jobs and to care for the other children at home, all while other members of their family are struggling with COVID as well. There's currently 5 children connected to ventilators, breathing machines, in the hospital I work in right now. And school is just starting in Alabama. In the past year, the unprecedented demands on healthcare workers has been tremendous. Save the lives of people who flouted masks and vaccines, without sufficient PPE to protect yourself or your family. Watch people die around you. Almost 4,000 healthcare workers in the U.S. have died from COVID. 4,000. That's more than the lives lost from 9/11. I personally have had 3 colleagues die from COVID. While the nation has moved on and opened up, while schools and governors block efforts that could prevent this disease, masks and vaccines work. They're likely our only way out of this. Physicians and nurses are emotionally, physically, and morally exhausted. We watched India suffer with the Delta variant and families scramble to find oxygen. But we in the U.S. went on with our lives, and we went to restaurants and movies and birthday parties and sang in our church pews. Now that the Delta variant is here, now it's in our backyard. I'm a scientist and an epidemiologist, and we are tired of shouting the same thing. Masks and vaccines work. Use them. There are extremely rare side effects from some of the vaccines, this is true, but every single one of them is exceedingly rare. Your risk of getting the blood clot associated with a vaccine is higher than average, but your risk of getting a blood clot from COVID is 100 times higher than average, and much higher than the vaccine. Your risk of dying from COVID, yes, it does depend on your age, but on average, about 4 out of every 100 people who contract COVID will die. Your risk of dying from COVID after the vaccine, less than 1 in 10 million, maybe even less. I'm tired. Healthcare workers are tired. Epidemiologists are tired. COVID is a horrific plague on this world, and we need you to step up. We need you, the grandparent, the business owner, the concerned citizen. We need you to take the baton. We are tired, and we cannot continue fighting this pandemic alone. Schools are being sued over the mask mandates to protect children and staff. Call and write your senators and governors. Demand masks and vaccines for your workplace, for the workplaces you visit. Call your local school board and demand masks to protect your children. Stand strong like Carly Simon, a superintendent of one of the public schools in Florida, who is literally risking her job and her pay by mandating masks in their schools in defiance of the governor's stance against masks. Mississippi and Tennessee are overflowing with children hospitalized for COVID. Alabama and Georgia are short behind. Mississippi has set up field hospitals again for COVID patients. Mississippi and Alabama are calling on healthcare workers from out of state because there are none left. We need more people like Ms. Simon to stand up and make a stand. Masks and vaccines are not political. They are basic public health measures that save lives. And we need them more than ever right now, before we are completely out of children's beds. And we're talking about rationing care for children. Do everything you can to fight against this plague. to fight for your family, your neighbors, and for our children.